I am background family medicine and addiction medicine, and I'm your facilitator for ECHO, ETSU BMAT ECHO. So thank you everyone for being with us. I'm going to let Scott Fitzpatrick introduce himself because he's my next tile. So if he'll just probably tell everybody again who and what you do.
Sure will. Hey, thanks a lot, Dr. Carson. Good to see you.
You too.
Yeah, so I'm Scott Fitzpatrick, and I am, as my opening page here shows you, that I own East Tennessee Acupuncture Clinic. I've been here practicing medicine for about 20 years. And about 15, 16 years ago, I joined as an adjunct faculty member with Quillen, thanks to Dr. Blackwelder. And now recently I'm doing a lot of stuff with the addiction medicine, because my primary focus in acupuncture is pain management. So a little brief presentation here on non-pharmacological pain management options. I don't know how many of you guys have ever had acupuncture or are familiar with it at all. But I'll try to make it not so boring that you fall asleep, and just entertaining enough where you'll be interested in maybe learning more, which is my hope. So, but this is my disclosure. I don't have any financial interest or arrangements or affiliations that would be considered conflicts of interest. So, and I am going to figure out how to make sure this thing works, and try not to screw it too bad. So anyway, because I know we're on a short time frame here. I have my objectives are to make sure that we have a better understanding of different types of acupuncture and their uses. And when I say that, I'll talk about that on the first screen there. There are a couple different variations of approaches in acupuncture. We're going to cover those just briefly. And like I said, this is mostly to introduce and to hopefully start some conversation and create some questions. I want guys that are watching this to have a little bit better understanding of cupping and its uses and applications, because you do hear the word used, cupping used pretty regularly now. So this next screen here, really common traditional Chinese medicine acupuncture techniques. The first part of the screen here is the Western medical approach, which is what I lend to quite a bit. I did my training at a Chinese medical school in Houston, and we worked primarily with MD Anderson. So I got a lot of and this was back in the late 90s when chemotherapy was not so dialed in. The treatments were profoundly more aggressive than they are today. And a lot of the sequelae and the side effects from those treatments with the chemotherapy and radiation and surgeries, et cetera, we used to see a lot of. So I was trained in a very Western model, and that's what I want to talk to you. And that's why I think when I have the residents in here working with me, I feel like we have a really good rapport, and I'm able to help give just a couple tidbits of information that they could possibly take with them and use on their own. So we'll talk about the Western approach just a little bit. The traditional Chinese medicine approach, of course, is what I was trained in, and that's more energy based. But strangely, it's the same thing. It's just different terminology, just a slightly different approach. And then finally, the auricular needles, seeds, and pressure. We're going to talk about those things primarily today, because when we're dealing with addiction medicine, these are proven research-based tactics that and uses that make a huge difference in down-regulating these systems that are profoundly upregulated with these folks who have some addiction issues. Herbal supplements, I'm not going to spend a lot of time on those today, just because a lot of these folks that have addiction issues, what we would like to do is try to get them away from as many of these crutches that they have. There are a few herbal prescriptions that work extremely well. I have one that I use quite often is like a benzodiazepine it's an herbal medicine without the side effects, but we'll get into that a little bit, but don't want to focus on that as much, because it's not something that Western medical physicians would use as much as potentially the acupuncture. Now, the other things, certainly things that you guys can all use and use extremely well, and you probably use a lot of them currently, except for the Tuina. Tuina is body manipulation. It's like a massage chiropractic approach, and I use it quite often. We can't call it chiropractic because then the chiropractors get mad, and so we don't use manipulations. We use Tweenaw. The cupping is something that's used extremely efficiently in here and well, but the cupping is the inverse of a massage. It's literally the opposite of a massage. Massages are so wonderful at kneading and pushing. Cupping is wonderful at pulling the fascia, the skin, the fascia, the musculature up and taking tension off of a bone. Because what we're trying to do is articulation. What we're trying to do is facilitate blood flow. Diet, exercise, and meditation, certainly all things that as physicians, you guys are very knowledgeable in and hopefully practice what you preach, because as we all get into our practices after 10, 15, 20 years, we start breaking down if we're not taking good care of ourselves, right? So diet and exercise and meditation are profoundly important for this. All right, so acupuncture discussion. Let's talk about this. Like I said, and Dr. Troxel, I know we 12:30. When do you want me finished, time wise? Because I was told 15 to 20 minutes.
15 minutes, knowing what time it is right now, because I've literally run into the room. I'm not even
Yeah,
certain
it's okay.
what time it is.
Yes, ma'am. It's okay.
15 minutes.
Yeah. So you want me to go to about 12:35 or so?
Yes.
Yes, ma'am. Perfect. So I just don't want to talk too fast that we miss the important parts, and I don't want to waste a bunch of stupid stuff that takes up important time. So real quick, the Western approach. As you can see, these points correspond to actual nerve innervations. It's what you guys would use a lot for trigger points, and the any kind of injection therapies. But in funny with the Western approach to this is, the correlation is not always made, but with neurology, the neurologists, when they use EMGs or do EMGs, they do many of the exact same points we use in acupuncture. So it's funny, if I get someone's had trigger point therapy, they kind of understand what I'm going to do to them. But when they've had EMGs, patients always want to know if it feels like an EMG, because if it is, they're not coming in. As we all know, the EMGs are great for diagnostics. Acupuncture is more therapeutic. Same points, electricity, yes, but a little bit different approach. So that's kind of cool that we do have these things in common. The traditional Chinese medicine approach, of course, has been passed down for years and years and years, and it has grown and it has expanded with the addition of knowledge and the addition of research. When the Chinese first started doing acupuncture, it was on prisoners and folks that didn't have a lot of options. So I'm sure that's how they really gleaned most of their experience. But the points have been really dialed in, and they are the exact same. The Western and TCM approaches are exactly the same. Auricular approach is a little different. The two that you've heard people speak of mostly is of course, the NADA approach, NADA, and the battlefield acupuncture approach. Both highly effective. They can be used in any situation, any setting. The beauty of the auricular approach is that in any doctor's office, any physician's office, you're trained to do it, or you have someone trained to do it, a nurse or medical assistant, it's a good way to help downregulate someone's system, get them calmed down, but also kind of get them engaged so that they understand they are getting an actual treatment, and that hopefully will have a scientifically proven benefit, but also a pretty significant benefit as far as just interactions with a patient. So the placebo effect is, of course, really huge. So some of the points, Chinese and Western. LI4, for me, that's large intestine 4. We're not going to go through all these, but that's a superficial radial pulse or superficial radial nerve. That's exactly what that stimulates. You guys that have worked with me, I know Mallory has, and I can't remember who else was on the in a meeting today, but you've seen me use this. It's the point in the hand between the thumb and the first finger. It's a very sensitive point. It's a great point to massage and it's great for headaches and stress. But so you've heard me call it HUGU, or large intestine for it, superficial radial. This whole list here, and I don't know if you guys have or would ever need this list, but if you're doing trigger point, even if you're doing just pressure points, just with your fingers, working on someone, checking their neck and shoulder for pain, that would be gallbladder 21, the spinal. Well, that's not it. Where is it? Yeah, I guess it is the spinal accessory nerve. That should have a G in front of the B, not just B. It should be a GB21. That's the spinal accessory nerve. Put a needle or heavy pressure in here, it affects the head and neck. If you guys ever need these or are interested in any of these points, on the right hand side, you can see there's sural, medial, popliteal. All of these nerves are great points for sciatica, lower back pain, facial pain. I treat a lot of TMJ. We see a lot of, and I don't know if you guys have seen much of it, but with the mask that folks are wearing, I'm getting a lot of people with dental pain, broken teeth grinding that have never done it before, a lot of TMJ pain, and even unfortunately, some trigeminal neuralgias that we're seeing that we use a lot of acupuncture for with the mask wearing. I put together a really simple slide here just to show some of these points, just to give a little bit better indication and explanation of why, if we do a needle in a certain spot, how it affects the spinal segment where those nerves innervate. At the very top on the left hand side of the screen, bladder 10, gallbladder 21, you're talking about the base of the skull, greater and lesser occipital nerves. So somebody with occipital neuritis, occipital headaches, lots of tension in their neck and shoulders, these are great points to use. And these are all points that as a physician, you're should be very comfortable using. And I'm going to slip on to I'm going to go through this real quick because I want to get to the auricular part. But here's that large intestine 4 point, the one I showed you earlier. Great point for stress, but certainly a direct correlation to the nerve. So in auricular medicine, auricular acupuncture, you can see there are some pretty large nerves innervating the ear. And we talk in Chinese medicine, if you look at the ear, it looks like an upside down fetus with a head at the base, spine of the ear goes up, and then if you can imagine, superimpose an infant upside down in a fetal position, that's kind of what you're looking at. The other thing you'll notice is that the ear is very similar to a kidney. It's one of the very first things to develop in utero, and that's why they hypothesize a lot of these nerves have terminal branches that do affect the vagus nerve, or trigeminal. I use a point right here in the middle of the ear that stimulates the vagus nerve for folks who have trouble going to the dentist and have a bad gag reflex. And real quick, and I'll wrap it up because I know Dr. Trox, you guys have a lot of moving parts here. Battlefield acupuncture points, this omega-2 Shinmin, those of you guys that have seen the NADA protocols and the battlefield acupuncture points, these points are things that I can teach you to do if you're ever interested. As you rotate through my office or my clinic, we'll teach you how to do these in a very safe, very effective and efficient way. Some other points, these are more some of the NADA points, and these are the ones I use a lot. The Shinmin, it's a spirit point. Kidneys, all this stuff is easy to find online, and I would be more than happy to go into it in depth. Cupping, you can see sometimes people get a little overzealous with their cupping. I try not to bruise people like this because then there's a lot of explaining to do. I do much more of a moving cupping, which is I'll put some coconut oil on and run the cups up and down the fascial planes. And then really quickly, just in conclusion, just everybody's different, everybody's pain's unique. And I don't ever let people compare their pain to somebody else's pain, or addictions to the other addictions. It's all unique. And then here's my quiz, Dr. Trox. Should we do the quiz now, or is that later?
I think when they get their evaluation, the quiz shows up on the questions show up on the evaluation. So
they're pretty tough questions. So
I know, especially since you gave the answers.
Well, they told me to. They said make sure you put the questions. All right. Of course, I'm doing this, last night at midnight because I didn't realize I had to make up some questions. But anyway, hey, I appreciate you having me. It's good to see you, Dr. Oxford.
Yes, you too. Thank you, Scott, so much.
Hope you're doing well. If any, and I know I'll blew through this, but if anybody has questions, you've got all my contact information. I think Dr. Larson does, Jack does, and Mallory, those guys. You guys have any questions about this stuff, you feel free to reach out.
Definitely, we will. We really appreciate your time, Scott, because having different ways to address pain, especially in those who deal with addiction, we need them. And you've got some real winners there that you've shared with us, and just even offering your advice and willingness to teach us, we greatly appreciate. Does anyone have any questions for Scott right now while we got him?
When I'm with you next Monday morning, I'd like to learn the ear.
Oh yeah, sure. We'll make that a priority. And I'll even give you some needles to take home and use on someone special. We may get Troxler in there. We'll be sticking some needles in her ear.
I volunteer. You can poke me, Valerie.
Hey, but I'll make sure we do that for sure. We'll get somebody in here or a couple people in here next week. We do the auricular points to that knot protocol for sure.
All right, cool. Thank you so much, Scott.
Thanks. Good to see you, Joyce. Hey, if anybody needs anything, please feel free to reach out. I'm pretty easy to find.
And if you realize after the fact that you really wanted to ask him something, you want to get back in touch with Scott, you can just ask us and we'll get you his contact information.
Piece of cake.
Cool. I'm gonna see you later, Scott. I'm gonna go ahead and have Brian introduce himself because we didn't get to do everybody's introduction, so we've had some people join us, so we all get to do it now.
Hi, I'm Brian. I am the technology coordinator for East Tennessee State University